Please describe how you collaborate with your local public housing authority.
Okay, our local public housing authority is actually one of our greatest partners in this area. We have two medical sites for our health center and one dental site. And one of the medical sites is literally embedded in the campus of the public housing authority, and I think it's probably the only business within the campus of that particular public housing authority site. And then our other main site, which is across the street from our dental site, is just down the road from the other campus. So everything to our immediate, or I say most everything to our immediate east is the public housing authority. So I would definitely say by proximity, we are very, very close to our public housing authority. But even more than that, it's the culture, it's the missions of the organizations. You have a public housing authority whose mission it is to provide affordable housing to the vulnerable, and then you have us, the health center, whose mission it is to provide health care to the vulnerable. So we're serving the same population, and that, of course, that correlation between having affordable and adequate housing and having good health is a direct correlation.
Okay. What motivated the partnership for the collaboration?
Well, years ago, frankly, before I even started working here, I was working with the former executive director of this health center, and it was right after I had gotten a public housing primary care grant for the health center that I was at in Waco, Texas. And in speaking with the executive director of this health center at the time, I was sharing with her just what an incredible advantage it was to be able to have that funding source, to be able to target being able to serve a large group of folks. And then public housing in itself is unique. There are unique health disparities that are in a public housing environment. And so my predecessor here at this health center I guess heeded the word, and herself went after being able to get directed resources, the grant money related to that. So it is very much related to being able to serve that particularly underserved, special population, and being able to get the resources to do it.
What immediate benefits have you seen as a result of your partnership?
Well, it's interesting. It's the health disparities have been reduced. So there's greater access to and lower disparities in the provision of primary health care services to the special population that is public housing primary care residents. So and those data is not just me blowing smoke. It's just the reality. You can look at our UDS measures, our QA measures, and you can see that we do extraordinarily well with all of our QA measures across the board, universally. But you can see it, coming out in the public housing primary care quality measures as well.
What are some of the challenges and strengths of your partnership?
A two-part question. It's listed as one, but there's two parts to that. So let's talk about the strengths. And I'll come back to on the strengths, it's proximity. I don't know how we could be more proximate, how we could be better situated to be able to serve the vast majority of the public housing primary care residents in our community. And then secondarily, it's those missions. The housing authority, once again, is there to meet the mission of providing affordable housing to a group of very vulnerable people. And here we are immediately proximate, and we have a mission of providing high quality primary health care services to the vulnerable. So those two factors, I think, in particular, really are the strengths of the relationship we have. I should also say, I mean, of course, every health center that is a public housing primary care grantee needs to have, should have, it's not just required to have, but should have a member of the public housing primary care, public housing community on their board of directors of the health center, and we have that, and we have a very good one, a member, if you will, of the administration of the public housing primary care authority here in our region. So 3 strengths that I can think of right off the bat. Challenges, the challenges are not as pronounced specifically in our community as they are for the entire state. I mean, I think the biggest issue is having resources to be able to serve the vulnerable. Clearly, the residents of public housing qualify as vulnerable, and we have a state that is choosing not to expand Medicaid, is choosing not to close the gap in coverage, and of course, there's a direct correlation between having access to quality of care and then having essentially a good quality of life. And so I think the greatest challenge is tied to essentially living in a state that's not expanding Medicaid, and that would unquestionably serve a lot more of the public housing residents than what we currently have available to us.